Okay, Griselda. All right, I think you have my patient. I have patient E. He's a 60-year-old male. His date of admission was 6/6/18. It is currently 6/7/18. Patient was admitted to the ED due to complaint of increasing pain in his right lower extremity. Reports redness, heat, and increased swelling in both extremities. At first, it started his right lower extremity, but now it has spread to his left lower extremity. Diagnosed with cellulitis. Lots of stuff on his health history: AFib, cirrhosis, COPD, core pulmonale, obesity, past history of lower extremity cellulitis, so probably gotten worse, and other stuff like that. You can just look at it later. MRI was scheduled at 6/7/18, which is today. Was completed late this morning, and for cellulitis and is resting. We're just waiting for the results to get back.
Do we have the result of MRI yet?
No, we're just waiting for it to get back. Patient is now back in his room. Is receiving antibiotics and is resting. Reported a pain of 0. Later in the day, he had a report of 2. We just gave him some medication for that. Vitals remain within normal limits. Continues to be on antibiotics for his infection and is getting wound changes regularly. So permanent labs, MRI, results not back yet. Was present for the MRI, and the tech pointed out there's an infection has spread to the bone, but nothing for sure yet. Labs, sodium, potassium, glucose, platelet, normal. Some of abnormal labs that mentioned are white blood cell. It was a bit high upon admission, but now it's getting more back to a regular basis. Iron R, hemoglobin, RBCs are all a bit low, so should look into that if it gets worse. Some prevalent medications. He's on gentamicin and Zosyn to treat his infections, and some of the other medications that are prevalent. He's on apixaban, atorvastatin, diazetam, docusate sodium, metoprolol, and trazodone. So basically, just a bunch of meds for his blood pressure, cholesterol, for blood clotting, and trazodone is for his depression because he has depression in his health history. So just in case you're not familiar, cellulitis is a bacterial skin and soft tissue infection which occurs in the physical skin barrier. Immune system and circulatory system is impaired. Also, cellulitis is common in the lower leg. So bacteria are most likely to enter through disputed areas of the skin, such as recent surgery, cuts, puncture wounds, ulcers, dermatitis, stuff like that. So head-to-toe assessment, vitals within normal limits. He has insomnia, safety checks, all good. Non-slip socks put on. Bed alarm working, call light near patient, was educated how to use it. Bed in low lock position, ANO ×4. He had a previous pain noted, but he was given medication for that. Diminished pulses in both lower extremities, so +1. Edema noted on both lower extremities, so +2. The rest upper extremities are normal. Normal heart sounds with irregular heart rhythm. No labored breathing and is on room air. Bowel sounds are normal, reactive, and is tolerating fine. He's eating normal. He is having normal bowel movements and has a Foley put in place to help him pee. Skin integrity not intact. His right heel plantar surface, diabetic ulcer, full thickness, wound bed not visible, 2.0 × 0.5 centimeters. So you could look at that on yourself to see. It's healing also with hyperpigmented center. There's no drainage. 100% eschar, ace wrapped, a leave-in placed over left medial heel, cleansed with Hybrid cleans and normal saline. So there's limited movement on both lower extremities. Both lower extremities are edematous, and his patient is unable to move ankles. However, he can walk very slowly with a cane, so just be aware of that. He can still perform activities of daily living by himself, but does need a bit of help with showering, knowing that it's going to be harder with his lower extremities. So some interventions that I think should be put in place, and nursing problems is impaired perfusion, so antibiotics, so medication. Just be aware of possible drainage. I know there was none upon my assessment, but just be aware of that. And
okay. So we got treatment for that, right?
Yeah, and hopefully it doesn't come to this, but possible surgery as an amputation. But I'm sure we looked into it, so hopefully that doesn't need to be done. Impaired skin integrity, monitor skin or wound around for spreading, so keep sterile dressing for wound care, and encourage a diet that meets nutritional needs. And so we can look into that. And just because of his past history of depression, so risk for situational low self-esteem, group therapy. Maybe we should change his medications for a bit because he's only taking one right now. Assess the patient's feelings of comfort with her own preference. And he's not religious, so maybe we could talk about that. So, and the expected outcomes of him is needs to be educated in how to properly dress his wound on lower extremity. He should be instructed how to properly float his heels because obviously he has that heel wound. He may need re-education on pre-diabetes diagnosis. He does have healthy history of obesity, and given his condition, he probably doesn't move around a lot. So just be aware of that. So he would also benefit with a health coaching regarding goals for weight loss, healthy food choices, increasing physical activity. It's important to talk through these things to see what he feels like he's capable of and goals that he feels like he can achieve. He struggles with depression, as mentioned before, so getting the right motivation to move and eat the right things and things of that nature. We haven't found out if he has insurance yet, so we should be looking into that more. But for now, we're just basically finding out the MRI results and seeing how cellulitis has spread, and we're going to act accordingly. Okay?
Okay, thank you.